the very first episode of Around the Coffee Table with Tajma Kotoric. I run one of the oldest medical associations in the country, serve on a couple of healthcare committees and a board. And I really felt like with everything that's going on surrounding the coronavirus, I really wanted to start bringing out the truth of what happens in our healthcare system here in the United States. Many people who hold commercial insurances really do not know what happens when they go inside of the physician's office, and when they leave, they only know what happens when they get their EOBs, and that's pretty much it. So everything that I say, everything that's mentioned on this blog is my own thoughts. They have nothing to do with any of the board's healthcare committees or even the job that I currently hold. So if you would like to see or hear anything as we are going through some of these topics, I will put my email address so you can email me, and we'll create topics and hopefully one day go live and I can answer them as we go on. Now, I think everyone's biggest concern here, especially in the Northeast, Pennsylvania, New York, New Jersey, has been the lack of PPE equipment. Now we're seeing these same concerns happen down in South, right? Louisiana, Florida, Alabama. We're seeing surges of new COVID-19 diagnoses, which is actually a good thing because that means that we're testing. But what happens when we actually go low? Why does it happen? And why haven't the hospitals really been planning? And that is what I've been hearing and reading all across social media, including Facebook and Instagram, not so much LinkedIn because I feel like that's more of a professional platform. And perhaps the people that I follow and they follow me back, we actually understand what happens in the back end. So I wanted to take a moment here to actually explain, right? So I wanted to give you a scenario. Let's say you have now been experiencing these chronic headaches and you decide, you know what, I'm going to go see my primary care physician. I have commercial insurance. I know what my copay is. It's $50. That's all that I have to pay for. So you call, you schedule an appointment, and you get it in about a day or two. So now you are sitting at the physician's office and the physician comes in and he goes through everything with you. He spends about, let's say, 14 to 16 minutes, develops a plan, and that physician feels like, well, maybe we should just go and schedule an MRI appointment just to make sure that it's not anything serious, right? Any abscess, brain tumors, whatever the case is. That same physician, after they write a script for you to get an MRI, goes through and gets the MRI approved by the insurance company, right? Now, the approval could be as low as 5 minutes, or it could last as long as 45 minutes because there's so many hoops to jump through. This MRI gets approved and you can now go on your way. But what has been happening, which we are not very happy about, is these insurance companies, specifically commercial insurers, right? Like United Healthcare, like the Blue Cross Blue Shields, is that they go back into the charts of these physicians. They could go back 3 to 5 years from the time that they saw you for that chronic migraine that you have been experiencing and saying, okay, doctor, I am actually going to do a chart review. And what they do is they say that they want to pick, let's say that physician sees 1,000 patients in that year. They pick 100 of those charts, pay a third-party company to go in and start reviewing each chart, each CPT code that they have used that equals whatever that physician spoke to you about, right? E&M codes that they use, CPT codes, modifiers, everything that has been previously approved by that health insurance company. They go back and say, well, that's not adequate. We're going to start taking your money back, right? So that visit that you paid a $50 copay, plus usually what ends up being is probably another $50 to $75 on top of that, or sometimes it's zero. Just the copay is what the primary care physician ends up getting for 15 minutes of their time. And they say, okay, that's not sufficient enough. We're going to start taking that money back because we don't feel like you have coded adequately. When, again, remember, 3 to 5 years ago, from the time that your physician saw you, it was okay. You got paid. And what they do is they hire these third-party companies, and these third-party companies get paid based on the percentage of money that they get back, which is based on the CPT codes that were previously approved. So I'm not advocating for a hospital, but I'm trying to explain how we are having a hard time budgeting for these crazy inconsistencies that are created by these health insurance companies. So imagine this, right? Here's an example. Let's say you are a gardener and you get hired by a couple to actually do gardening work for their house, right? They want landscaping. They want all of these beautiful things. And you go in, you do your job, and 2 years from now, the couple says, I'm not happy with what you did. My tree died, when probably they were not taking care of it. And they're like, I want all of my money back. I want all $5,000, $6,000, $7,000 that I spent on gardening supplies and equipment and the trees and your labor. I want everything back. How can you budget for something like that? You always need to have this crazy amount of money in reserve for instances like these. And this is what happens to hospitals. This is what happens to primary care physicians. This is what happens to specialists. More importantly, could you imagine you doing your job today and not getting paid for it for 4 to 8 weeks? And that is if you're lucky. That is if they don't say, and that they meaning health insurance companies, that, well, you didn't build this, we really want to document it differently, or it's under review. And then if that visit that the physician saw is under review, you might not get paid for 12 weeks. Could any one of us function that way? We can't. We would have to have thousands of dollars in savings in reserve in order to function like that. It's not the way business runs today, right? If you need a printer for your business today, you're going to go get a printer, right? You shouldn't really be worried if that client of yours is going to ask for their money back in 2, 3, 4, 5 years. That's not how business operates. Yet this is how health insurance companies operate. So when hospitals try to order PPE equipment, they're waiting for money that they have used from maybe a year ago, maybe from seeing that they just get paid from seeing patients maybe 6 weeks ago. All of this is quite concerning. And a lot of people who hold these insurance companies to come in from visits that they have probably seen 4 to 6 weeks ago. So it's very hard to budget when you really don't know when you're going to be seeing the money from services that were rendered 4 to 6 weeks ago. So you order as much as you can based on the supply and demand that you're going to be anticipating for that month. Now, I don't know how they order. Is it on a monthly basis? Is it every 3 months, every 6 months? I would assume it's on a monthly basis. But this is what we're talking about here in the United States and the way that our healthcare system works. Now, please be mindful. Everything is for profit here, and especially the commercial insurance holders. I want you to be mindful of the stocks that today, March 30th, 2020, are being sold under these insurance carriers. Now, United Health Group, they are at $248.28 today. Their 2020 net revenue was $242.2 billion in 2019. This year, they have promised their shareholders before coronavirus happened, I believe it was towards the end of January, the article came out to their shareholders, that their net profits are going to be $220 billion. I can tell you, year over year, this is my insurance carrier, year over year, our premiums have increased 23% every year for the last 3 years. I cannot simply go and get an MRI done, just like I used as an example of this patient. I have to go through my primary care physician or whoever is ordering the MRI. And what happens is they usually start playing games. You would call saying you don't need a referral. Your doctor would call and they say that you would need a referral. Anything to stall spending $1,500 of the $35,000 premium that it costs every year for a family of four. Aetna, as of this morning, their shares were at $212. Net revenue for 2019 was at $60.5 billion. Don't forget, I don't know how this is ethical, but they also bought CVS Pharmacy. And Cigna, just to use an example, I could keep going on and on with these health insurance companies. They were at 174.48. As of this morning, Cigna was trading at about $174 per share. Now, their net revenue from 2019 was about $153.6 billion. Now, at the top, right before the coronavirus occurred, they were trading at $224 per share. That's a lot of money. Now, whether you believe health or commercial insurances should be allowed to be traded on the stock market, I would love to hear from you, but I really felt like I needed to explain why PPE equipment was not adequately staffed. I could be wrong, but talking to a lot of physicians who are currently in the trenches, I'm definitely hearing a lot of information, which again prompted me to do this. So if you would like to hear more information from me, I'll provide my email address. You can shoot me anything. You can find me on Instagram, LinkedIn, and you can DM me with any information. I felt like I probably am going to try to do this on a weekly basis, especially pushing out the rhetoric about health insurance companies. I don't know about you, but paying all of this money, all these premiums on top of high deductible plans, high co-insurances, high co-pays, and to hear that state of California is already warning people that their premiums will increase next year at 40% on top of what they pay already, when you know that these insurance companies are raking in big amounts of money without paying physician the adequate fees, without paying the hospitals, the institutions, the urgent cares, what they deserve to be paid, and yet you are left with a larger burden each time you go to an ER. I mean, I would love to see what the costs are now with COVID-19. I know many of them said that they're going to make sure that they're writing off COVID-19 tests, but not so much what the costs are going to be in terms of going to the hospital. What if you need a ventilator, having around the clock care, what that bill is going to look like, and what they're going to cover from that bill. But yet already hearing that the premiums are going to increase another 40%. I mean, when will the market wake up and say, okay, that's enough? The average person cannot sustain that. The average small business cannot sustain premiums that are increasing that fast year over year, especially with an aging population. And now, you know, health insurance, the premiums are not based on how healthy one is, it's based on your age. So as you have an aging population, an aging set of employees, you are then paying higher and higher premiums, even though a 65-year-old could be healthier than a 30-year-old. So a lot of information to process here. I would love to break this down even further, hopefully at my next vlog and hopefully soon to be podcast. We can actually break this down, and hopefully one day I can actually go live as well and answer some more of your questions. But more importantly, if you have any direct questions, go to my Instagram page, find me on LinkedIn, send me a message. I would love to discuss more. That's what I've been doing pretty much these last 2 weeks. Is a lot of doctors are reaching out to me, a lot of patients are reaching out to me. And I am working with my network to help to answer some of those questions so that all all of us can be at ease, at least for something. So thank you so much for watching this first episode. I really hope you enjoyed. I hope you have learned something. I encourage you to look at your own policies and make sure you are aware of what is being covered under your policy. So God forbid you are forced to go into the hospital, which please stay out of regardless. Go to urgent care if it can be taken care of in urgent care office. If not, I guess you're forced to go to the ER. But at least you are aware of what your out-of-pocket expenses could be. And anyone that has been dropped from their insurance, whether you have been let go through these hard times, please reach out to your state, especially your state legislators. I know a lot of them are working to help each individual person. But if I could be a resource, do not hesitate to reach out to me. Thank you, and please stay safe and please stay at home.